Good morning, Dr. Anderson. Repeat command performance, I should say. We so appreciated having you on the first time, and the opportunity came up again. You, of course, the author of Universal Death Care, Solutions for Healthcare in the Age of Entitlement. I think that kind of sums up quite nicely your thoughts, but I know we kind of wanted to talk a little bit about Obamacare, since it is now a Supreme Court matter. You contend the system focuses too much on treating sickness and not enough on well care. First of all, welcome to the program. We hope you're well.
I'm doing great. Thank you for having me.
As a doctor, you should caution me on how much caffeine I actually ingest in the morning.
Everything in moderation.
That's it. Yeah.
Talk about what you feel are the flaws with Obamacare.
Well, I think Obamacare did a lot of really good things, and those things should be kept. But I think the pendulum swung too far on pre-existing conditions. So what Obamacare did in a very good way was they said that if you have a pre-existing condition, you can't be discriminated against by getting health insurance. And that's very good, because there are a lot of people out there who just couldn't get health insurance because they had a problem. The problem comes, though, that pre-existing conditions includes things that people could have prevented had they lived healthfully. And so what ends up happening is that insurances are forced to cover these people and cover their poor health decisions instead of holding them accountable for their health decisions and giving them a little bit of a stick, if you will, to become healthy on their own. And the stick is by paying more insurance premiums.
Doctor, could we do better in this country in teaching health and wellness, and maybe, even starting with like a grade school PE classes, for example?
100%. Listen, when I was growing up, I thought eating cereal was something that was good for me. So I ate cereal, and I ate it all the time. And when I grew up, and after I went to medical school, which, by the way, they didn't teach hardly anything on diet and nutrition, I started to learn that all these ultra-processed foods that we consume, which makes up the majority of the standard American diet, they're literally killing us. They did a study last year that said if you consumed more than 4 ultra-processed foods a day, you increase your risk of dying from all causes by 62%. Now, ultra-processed foods, those are your cereals, your hot dogs, your frozen pizzas, your sports nutrition drinks, your crackers, any of these foods that don't look anything like what came out of the ground. And literally, we are not taught this from grade school all the way through to medical school, and it needs to be exactly to your point. It needs to be part of our education throughout.
So all that Captain Crunch cereal I ate as a kid probably wasn't that good for me, and it probably wrecked my teeth, too, now that I think of it.
Yeah, right, those sugar, chocolate, cocoa bomb cereals, they're probably not the best for you.
And then, of course, all through high school and even into college, you'd go through the cafeteria. Some of that wasn't very healthy food, now that I think back on it.
No, industry has really done us a disservice, and unfortunately, it's big money. And a lot of the big food companies, they have huge departments that have figured out how to mix the right amount of poison to put into our foods so that we get a dopamine rush when we eat them, analogous to taking a hit of heroin or one of those things, and it keeps us addicted. They do the right amount of fats, the right amount of salt, the right amount of processed sugars, and it makes us addicted to them. They even put substances sometimes in our ultra-processed foods that decrease our ability of our body to tell us that we're full, so that we eat the whole box. It's atrocious, and we really need to do better.
Doctor, I have to ask, and I say this with all due respect, I would never deny a physician of any field the opportunity to make money, but it seems to me there's a lot more money in dealing with an illness than there is in prevention and treating people or educating them.
100% correct. Listen, I think the vast, vast majority of physicians and healthcare workers got into medicine to prevent disease. Because when the wheels are coming off the bus at 60 miles an hour, that's the wrong time to change the tire. Time to change the tires before it even gets on the road. And we're, one, not taught that. But two, there's not a lot of money in telling people to eat your peas and carrots. And there's a ton of money in treating death and disease. and the whole system has focused on death and disease. That's actually one of the great things about the ACA, or Obamacare, if you will, is they put a lot of stuff in there that insurance companies had to cover preventative services, like different shots, different immunizations, different screening, age-appropriate screenings. And the ACA actually did a really good job of mandating that insurance companies start to refocus on prevention. We just need to do more on that, and we need to encourage the individual patient to take personal responsibility so that they don't need health care in the first place. And by the way, if people are wondering what the absolute best way is to fight the COVID virus, yes, wear your mask, do your social distancing, but the best way is to become healthy so that if you get sick, it's not going to affect you severely.
You know, you hear about the worst cases of COVID deaths, and each one just breaks your heart. But there's always some mitigating circumstance. They're diabetic, they've got cardiac issues, lung, obesity. It's not in every case, but that seems to be a common theme.
Oh, 100%. And some of the other common themes are low vitamin D. I mean, we know that the vast majority of people who have a severe reaction to COVID have very low vitamin D. And please, everybody listening to this, don't think that you get vitamin D from the sun. The amount that you get from the sun is not enough. And if you go out and try to get your 15 minutes of sun every day, you're going to give yourself very little amounts of vitamin D, and you're just going to be growing more skin cancers for your local dermatologist to treat.
And I don't drink milk, but I take a little vitamin D pill every day.
Absolutely. Yeah, it's dirt cheap. You can get a year's worth of vitamin D3 and talk to your local doctor about what dose is right for you, but somewhere between 1,000 and 5,000 international units a day. And that's probably going to cost you less than $10, $15 a year, and it will greatly improve your health.
Do you foresee, even in the hands of the Supreme Court, where Obamacare will, of course, back off of pre-existing conditions and become actually more affordable?
Well, so it's interesting. Healthcare became more affordable for some people under Obamacare, and for some people it became less affordable. So I think that President-elect Biden is going to have to do something with what you said earlier, educating, starting the education of diet and exercise and mental well-being earlier in life and continuing it through. I think that we're going to have to do something with making people responsible for their individual health choices. Otherwise, it's going to bankrupt the system. And so between 50 and 85% of all healthcare dollars that are spent treating conditions that people could have prevented had they lived healthfully. And so you ask about Obamacare. I think that us putting everything into Obamacare's hands and saying you need to fix everything, or in the government's hands saying they need to fix everything, I think they have a part in it. But I think the individual citizen has a personal and collective responsibility to make our health system sustainable.
You know, a lot of this explains now why I look like a barrel at the age of 63, because I'm thinking back to my early bachelor days. I didn't give any thought to what I might be eating. And in fact, a lot of nights I drank my dinner. So it was...
Absolutely. But, it's never too late to change. Our bodies are amazingly resilient. And so now is the time, today is the day. And it's not just so that you can pay less for health care, so that you feel better, so that you can live to your potential. So, it's the ACA is at the Supreme Court. They heard arguments last week. And it seems like, once again, for the third time, they are not going to repeal Obamacare. There's multiple problems with the argument that's before the Supreme Court right now. And I think what we need to be doing as a people is not trying to throw the baby out with the bathwater, not trying to do these partisan power plays of, well, the Democrats shoved this down our throat, now we're going to abolish it. Why don't we take the reasoned approach? Why don't we see what worked well, like preventative services, like pre-existing conditions? And why don't we make it better? Why don't we change this so that the pendulum doesn't wildly swing yet again? We've got a lot of problems in this country, and it seems to me that we should be finding constructive ways of making them less problematic instead of trying to get back at the other side of the aisle.
One more question for you, Doctor, before we let you go here. We've got this major public health crisis that's been with us now for 8 some months. From the government all the way down to the general public, how well have we reacted and managed this thing?
We're the worst developed nation in the planet by how we've managed COVID. I mean, there's no debate on that. So we have, less than 5% of the world's population, and we have way, way, way more cases and deaths than we should. We are ranked 37th in the world among healthcare systems, 37th. Everybody thinks America is the best at everything, but we're not. We really need to focus on this. We need to actually do our research and see how we can do better. Places like Thailand, they basically have no cases and hardly any deaths compared to the rest of the world. And they have enormously populated systems. America, we got an F in how we handled the pandemic.
Dr. Anderson, we have to have you back, as Jay indicated before. There's no way we're going to get through this in just a few minutes. And I know I just finished universal death care, so it's his turn now. We'd love to have you back, because we haven't even begun to skim the surface of this topic, I don't think.
Well, I'd love to be back, and thank you for reading the book. I'm honored you did. I poured my heart and soul into it and tried to be very vulnerable in the book and tried to be very honest with people. We need to do our own research. We need to do a couple of Google searches and challenge all of our preconceived notions on healthcare. And I think if we do that, we are a strong, resilient people, and we will find a better way.
Doctor, thank you so much. We appreciate your time.
Thank you so much. Be healthy.
You too. That's Dr. Reagan Anderson. His book, Universal Death Care, a Solution for Healthcare in the Age of Entitlement. And we'll be back.
8:57.
Yes.
Yeah, on the morning meeting.